You know what? The first patient, was my mother. That's my mother. She was 85. It showed that her age was 89. And now in 1 year, I made it 88. I gave my mother 1 year more of natural life at 85. What more can I do than give somebody extra years of life? This is science. This is biology. This is not hypothetical.
Dr. Alok Sharma is a neurologist, director of Neurosurgeon Brain and Spine Institute and KLS Wellness Institute from Anti-Aging, Navi Mumbai. He is professor and head of neurosurgery at LTMG Hospital and Medical College, Sion, Mumbai. Welcome, Dr. Sharma.
Practically tried and tested on myself actually, and then on a whole lot of patients. So I'm basically a neurosurgeon, and you'll wonder, what is a neurosurgeon doing in anti-aging? So very early on in my career, I shifted to the field of regenerative medicine, apart from doing regular neurosurgery. I realized that the ultimate hope in medicine was regeneration at a cellular level. And slowly I learned the power of nature, that nature, natural tissue, and what nature provides, earth, wind, rain, fire, have actually all the solutions to medicine. And it is this, and then when I started treating incurable neurological diseases, whether it was stroke or dementia in children, autism, cerebral palsy, I realized the power, the natural power the body has to heal. And anti-aging was created out of that. So we all are familiar with what aging looks like externally. As doctors, we are all familiar with age-related disorders because we treat them. More than 50% of our practice is disorders that are age-related. But what we are not aware of is that aging starts within the cells at a cellular level. And anything that happens to the cells can be modified now using various simple technologies. So one of the key marks of aging is what is called telomeres, and I'm going to talk a little bit about that. There is changes that happen with protein synthesis. There is problem with nutrient sensing. The mitochondria get affected in a significant way. There's cellular senescence. There's exhaustion of the natural stem cells in the body. So this whole combination, and this is a separate talk all by itself, what happens at a cellular level, so I can't go into it for want of time. So what is new? I'm going to talk practical stuff. First, we now have a simple blood test that actually tells you your cellular age. It is called telomeres, just like blood sugar tells you, or HbA1c tells you exactly what your diabetic level is, or like your creatinine tells you what your renal function is. You now, through a simple blood test, can know your telomeres, and it will tell you what your real body's age is. Not your chronological age by birthday, but what your cellular age is. But what's the use of finding out if you can't correct it? They are very simple, non-invasive, yes, non-invasive medical technologies which can actually slow down and in fact reverse the aging process. So the key to this is something called telomeres. We are all aware we have chromosomes, and the tip of the chromosomes, very much like the nail of our finger, is what is called telomeres. Now telomeres, from the time we are born till the time we die, keep on reducing, and over a period of time, you can see when you are small, and if you look on the left-hand side, you can see the telomere is reducing. And when the telomere becomes 0, that is when the cell dies. So you can actually, by knowing your telomere length, know when you are likely to die a natural death. That can now be scientifically predicted through a simple blood test. So telomeres are really DNA protein complexes at the end of the chromosomes. They actually protect the end of the chromosomes and help them to remain stable. As the telomeres shorten, cells age, die more quickly. So basically, like I said, telomere length is an indication of biological age. So almost all age-related diseases, everything, cardiovascular, dementia, obesity, stroke, all of this, telomeres start reducing. We have been looking at certain fatal conditions like motor neuron disease and ALS, and we find dramatic changes in the telomere levels. Now here's the exciting news. Telomeres show us that we can biologically live up to 120 years. Our telomeres say that but none of us live because of our lifestyle and all that. The oldest lady who's ever lived has actually lived up to 122. So a telomere length, a natural telomere, is supposed to become zero at 120. So that's the maximum possible age we can live. And this lady has actually lived up to 120. Now, there are two very interesting studies, one of them from America, one from Israel, which give us some very simple and very interesting insights into telomeres and aging. Now, this is the study from the United States on how simple lifestyle can affect aging and telomeres. Now, we all know this, but now this is being proven through simple biology. So this is that paper written by Dean Ornish, and in this he took patients who had prostate cancer and did a 5-year study with them. Look at the result. In the intervention group, so in the control group, that is the group which continued life the way it was, the telomeres decreased as they decrease with all of us. Telomeres keep on decreasing naturally. But in the intervention group, it actually increased. This has never been documented in history before. Telomeres never increase, they always keep on decreasing. And what was it? Vegetarian diet, exercise, yoga, meditation, social activity in 5 years. But of course, this took 5 years. That's a long time to live this life, but there was nothing challenging about doing that. But this was 5 years. But we are not that patient, right? We want results faster. So here's the next study. This came from Israel, on the role of hyperbaric oxygen therapy on telomeres and aging. And this is the paper that was published from Israel, which showed the effect on aging cells. And they showed something very interesting. Here they took 64 patients, gave them 60 sessions of hyperbaric oxygen, and they actually showed an improvement of about 20%. You know, the HBOT, the number of cells that were aging, decreased by 10 to 37%, and the telomere length increased by 20% over 60 days of hyperbaric oxygen. So I'm going to repeat this. One study from America, vegetarian diet, exercise, yoga, meditation over 5 years increased your telomeres by 20%. A second study from Israel, 60 days, 60 sessions of hyperbaric oxygen, exactly the same result. All right. So this is the data from the Israel study. This is a study I did on myself. So I'm 60 years old, and I did my telomeres, and I found my cellular age was 85. I remember I was shocked. I said, this can't be, you know. I can't be aging so rapidly. Then I started, based on the Israel study, I started taking hyperbaric oxygen, 40 sessions every single day. No other change. The same food, the same diet, the same, everything that I was doing, exactly the same. And in 40 days, it came down to 70 years. So I had an improvement of age, 15 years, from 85 to 70. Then I continued another 20 sessions of hyperbaric and brought it down to 65. And then I stopped for a period of some time, and it came down further to 60. So this is me. Okay, these are my telomeres. 85 on day 0, 10-year, 15-year age reduction after 40 sessions of hyperbaric. Another reduction of 5 years on day 80. And by day 120, my chronological age matched my biological age. So this is something I first showed on myself. And then what we did is we started doing a clinical study within a hospital. We took people between ages of 55 to 85, those vitamins. And we found symptomatic improvements in memory, in anxiety, in depression, in sleep issues, in mood swings, in palpitations. We found improvement in muscle pain in 100% of the patients. Joint pains improved, gut issues were resolved. There was the loss of appetite was improved, urinary incontinence improved. Exertion, physical exertion, which was there, diminished. Difficulty in mobilization, skin elasticity, reduced hearing, reduced vision, varicose veins. So you can see these are the percentage improvements of anti-aging therapy. And this is just that data, and we did a statistical evaluation and found that it was all significant. Then we did the biochemistry. So, we looked at the hemoglobin, fasting blood sugar, postprandial, ESR, C-reactive protein, creatinine. There was improvement in all of them. This is just the data to show you the biochemical improvements. Now here's the telomere improvements. Now this is interesting. These are 12 patients, and you can see the first column, this is the actual age of the patient was 85. Telomeres, biological age was 89. Okay, but in some patients like this one, it was, the actual age was 81. Biological age was 96. It reduced by 6 years. Some people it reduced by 8 years. So you have to understand, telomeres never improve naturally. They only worsen, all right? So even if you have a 1 year or 2 year or 5 year improvement, you have put the brakes on aging. You've slowed down the aging process. So this looks like, what is 1 year, 2 years, 6 years? You know what? The first patient, was my mother. That's my mother. She was 85. It showed that her age was 89. And now in 1 year, I made it 88. I gave my mother 1 year more of natural life at 85. What more can I do than give somebody extra years of life? This is science. This is biology. This is not hypothetical. This is not philosophical. This is not science fiction. This is real. The first patient that's my mother. All right. So I was just so happy, that I could reduce her telomeres by 1 year. And at 85, that's like a huge thing to do.